To start off our presentation, we want to identify what is radical belonging. We've all heard the word belonging and could give a general definition of it, maybe feeling included, fitting in, or other similar phrases. But radical belonging is so much more than this. To come up with a team definition of radical belonging, we went to the literature to get a grasp of what exactly this concept is. A genderqueer author, Lindo Bacon, writes their book Radical Belonging about what it feels like to be marginalized. They state how isolating it can feel when you're different. Radical belonging involves coming face to face with all the injustices that have happened in the past. They state we must collectively heal from these past traumas and attempt to move forward with a culture of respect and empathy. They also express how that what is preventing radical belonging is not an individual problem, but an overarching issue of injustice in the world. The article, Toward Radical Belonging, Envisioning Anti-Racist Learning Communities, by Louis et al., promotes radical belonging as a guiding vision for schools to eliminate discrimination of all forms. It is highlighted that radical belonging requires no less than transformative change in order to make a difference in our world. As you will see on the next slide, we included the word purposeful in our definition because based on this article, it seems that despite knowledge that there are clear disparities between white and Black people, willful identification of norms and expectations have not been examined and adjusted. It is crucial for individuals, communities, and systems as a whole to interrogate their own implicit biases and question why things are a certain way. After some reflection, our team definition of radical belonging is as follows: a collective, ongoing, action-filled effort of diverse peoples standing in solidarity to bring about purposeful, permanent change regarding equality, acceptance, and respect of all people to promote a worldwide community that benefits from its heterogeneity.
Belonging in a healthcare team. The feeling of belonging is a fundamental human need in general, also in a healthcare team. Connections or bond is important in every stage of the team process and often essential to improve patient healthcare outcome. For instance, if a member of the IPTS feel like they belong to a team, that member may have a sense that their role at work is safe, accepted, and welcome. Therefore, there will be an increased performance and a burnout reduction. Contributing factor to a sense of belonging in a healthcare team. We have communication, trust, respect, collaboration, and improving healthcare outcome. For the communication, trust, and respect, internal professional care require team members to be able to communicate, trust, and respect each other in order to push boundaries to provide the best care, the best patient care. And for the collaboration, uh, it is done through education. So, interprofessional education occurs when learner or practitioner from two or more professions you know, learn about each other in order to be able to collaborate, and improve health outcome. And for the COVID-19 has been physically, emotional, and economically difficult for everyone, either for healthcare worker or population, but has hit some groups harder than others. So healthcare workers are under more pressure than ever after the after the healthcare workers shortage that stemmed from COVID-19. For instance, we see less team meeting and event outside of workplace, less time for small talk and etc. So for the Black, Indigenous, and people of color, those has been really affected by COVID-19, which makes more isolation and less feeling of belonging.
We developed a three-tier Hope Commission proposal, starting with organizational, and then team, and then individual recommendations in order to increase a sense of radical belonging in the healthcare community. So first, we propose that the organization provide teams with adequate time for interdisciplinary team meetings on a regular basis. So obviously there will be further discussion needed on how to create this time, but we felt like time for interdisciplinary team meetings could help create a sense of belonging and communication between disciplines so that people feel like there's more communication and understanding between teams, as well as it just overall an increase in collegiality and friendships among more individuals at the hospital. Next, we propose to hire an adequate amount of qualified staff. So many hospitals, including this one, have suffered from a shortage of healthcare professionals, and this leads to staff feeling burnt out and isolated and overworked and underappreciated, as well as many staff members feel like they signed up in order to do a job the way that they had hoped and to the extent they had hoped, and they don't feel like they can do that right now due to the shortages and having too many responsibilities to do in the amount of time they have to do it, and therefore they have to do less than they would like, and this leads to further burnout. Next, we have ensure resources are available for individuals, including access to behavioral health, PTO, medical insurance, time off for appointments, childcare, etc. So many of these resources, if they're not available, it makes it so the individual does not feel taken care of outside of work, and then they don't have the energy and extra reserve to bring to work when they get here. So we need to make sure that they're being taken care of in ways that they can feel rested, with vacations and financially taken care of during those vacations, as well as medical and behavioral health resources outside of work, and then childcare for any of the individuals with children. I know this is a very important topic, and then also time off to make those appointments and deal with those things. The next two kind of go hand in hand, but pay professionals a support staff wages that reflect their value, and then also equally or better to staff members compared to traveling professionals. So we felt like it's really important that people feel valued and taken care of, and this would be reflected in their financial compensation, because this makes individuals have to be able to take care of their families and themselves and not worry about this while they're at work or while they're at home. And then they come back and they feel more refreshed and ready to manage things at work, and they feel ultimately like they belong because they're well taken care of. And this includes benefits so that they can get medical and dental and all the insurances for themselves and their families. And also, I think the traveling, especially with like nurses right now, it's very important that we pay the staff that stay there, because they're more qualified to manage the unit that they stay in, whereas these traveling nurses are more than qualified. However, they travel so much that they don't know the specific environment as well, and that can lead to errors as well as a loss of belonging due to the constant change of staff. So I think this will be really important going forward. Next, for the organizational, we have adequate diversity, equity, and inclusion training for gender, race, sexuality, and everything else. We felt like this was really important, that people feel like they have adequate training on this and help create a better workforce that is well equipped to handle patients and feel included from a diversity and equity inclusion perspective. Next, we felt like it was important to ensure diversity among the workforce itself. So this should be taken into account when making hiring decisions. Next, we have create resources inside communities that need them to make them accessible, such as COVID-19 testing centers, masks, and vaccinations when we're looking at COVID specific. But we felt like from an organizational standpoint, it was really important for the organization to bring these resources to the communities themselves. And this would help create a better sense of belonging to the members that are from that community that work for the workforce, as well as the people in that community that need that resource. Also, we feel like it was important for there to be an office for reporting unprofessional behavior with follow-up about what is being done. Without this, unprofessional behaviors lead to increased isolation and members of the workforce feeling like they do not belong. So it's important that they're able to report it and have something done so that they feel like they do belong and that they have representation. Next, we have create opportunities for workers such as environmental services to gain education or on-the-job training in order to advance in their careers for no additional cost. So this is really important for our members that really want to move up and make a difference in a different position in our workforce to be able to get those resources and trainings that they need in order to be able to make that happen. And then lastly, we have create easily accessible resources for patients and family to reduce the amount of times healthcare workers must relay this information. So a lot of healthcare workers feel burdened by relaying all this common knowledge that we have to tell every patient about COVID and other common disorders. And so it feels like they're burdened by just relaying the same information over and over again. So if we have pamphlets and websites and different things that we could refer them to so we don't have to spend our time doing that, I think that would reduce a lot of burnout and help them feel like they can get back to their jobs and more belonging as well. Okay, moving on to our proposal for the team. We felt like it would be really important for every team to attend and participate in these interdisciplinary team meetings that the organization allows time for. This would allow each discipline time to contribute to the discussion. We even thought it would be important to have like a whiteboard or a person who monitors to make sure each discipline has an opportunity to contribute. This way they don't feel like they have to speak up and they feel like there's times allotted specifically for each discipline to talk to. I think this would help foster a sense of community and good communication among team members. Second, give others the benefit of the doubt during discussions and allow them to finish their thoughts even if you disagree. Then voice your opinion, support it with reasoning in a calm manner. So this is just important for all communication and important to be able to create a professional environment where people feel comfortable to voice their opinions. Next, we have allow for room for diverse opinions and acknowledge that they have merit, even if it does not coincide with your own experience or background. So this kind of goes into the diversity, equity, inclusion. It's important to understand and respect others' opinions and understand that we all come from different backgrounds and that different ideas have merits, even if you do not agree with them, and therefore you need to still respect them. And hopefully we can all learn from each other and create opportunities that best benefit ourselves and our patients. Next, we have time during team gatherings or unique events outside of work for small talk and socialization to unite team members and humanize others in the workforce. I feel like this would really help create a sense of belonging and community within the workforce. And I think it is a crucial part that has become really challenging in this tech era where everything is online and different things. Lastly, for teams, we have time during team meetings or a specific person at the meeting who is considering which patients need additional resources and will help create a plan to give those resources. So this could be social work or a quality representative, but we feel like it's important to have someone keeping track of who needs what resources and making sure they get them. This way, the members of disadvantaged communities feel like they know that we have people inside that are taking care of them. Next, we have a policy that discourages discussion of politics and other inflammatory topics in the workplace. workplace. I think in any professional situation, these topics usually lead to poor communication and frustration among team members and do not foster a sense of belonging. It further isolates individuals and needs to be discouraged. And then lastly, we have team leader that monitors team well-being, not simply productivity, and allows them grace when life is messy and for individuals. This will help. Hopefully, the leader can problem solve before punitive action is taken in cases that it's needed. And this will hopefully make it so members feel like they have a team member who's really looking out for them and wants the best for them and is doing everything they can to make sure they belong and are taken care of. Our final proposal was for the individual. So we felt like the Hope Commission can really improve if individuals make an effort to fill our own bucket in your free time. And this way, individuals come back rested and well taken care of, and then they can provide for their patients and themselves in the workforce. And then this will lead to less burnout and a greater sense of belonging. Next, they need to make an effort to lift others up and include them in activities and conversations as often as possible. This really just goes into making others feel belonged or a sense of belonging. If you want to feel like you are included, then you need to make others feel included. Next, we have reach out to your supervisor regularly to ask what you need as well as what they need from you. So this creates good relationship with your leadership, makes it so you feel like you know what is expected of you and what you need, as well as gives them an opportunity to provide what they need from you, as well as give you what you need from them if you're needing changes. Lastly, for the individual, continue to nurture your relationships to ensure you have a good support system and community. So this kind of goes into filling your own bucket, but just make sure you have your community outside of work and you're spending time making sure that these relationships are what you need outside of work so that you feel well supported and have a good sense of community both in and outside of work.
To consider the inequitable impact of COVID-19 on marginalized communities and the related stressors for the healthcare team members with marginal identities, first we need a combination of diverse workers at every level of the organization and adequate diversity, equity, and inclusive training. A diverse workforce allows the organization to create policies and services that meet the needs of a diverse population. The additional support of the organization to the individual will allow those from marginalized communities to feel supported mentally, emotionally, financially, and professionally. And then also, lastly, equal opportunity for discussion in team meetings will ensure that those who wish to support marginalized communities are heard.
The organization should follow the suggestions outlined in the previous slides in order to build the comprehensive environment that is needed to support staff and organization success. The short-term components of this are hiring adequate staff, paying those staff equally, and then creating resources that support employees. The long-term implementation steps is implementing team and individual training over the course of their work careers in order to build workers' capacity and a better workplace overall. An interprofessional team is better to support all aspects of this program. Interprofessional teams provide diverse opinions and best support a workplace environment through teamwork. Our team implementation steps work best with an interprofessional team. The organization should follow the suggestions outlined in the previous slides in order to build the comprehensive environment that is needed to support staff and organization success. The short-term components of this are hiring adequate staff, paying those staff equally, and then creating resources that support employees. The long-term implementation steps is implementing team and individual training over the course of their work careers in order to build workers' capacity and a better workplace overall. An interprofessional team is better to support all aspects of this program. Interprofessional teams provide diverse opinions and best support a workplace environment through teamwork. Our team implementation steps work best with an interprofessional team. The organization should follow the suggestions outlined in the previous slides in order to build the comprehensive environment that is needed to support staff and organization success. The short-term components of this are hiring adequate staff, paying those staff equally, and then creating resources that support employees. The long-term implementation steps is implementing team and individual training over the course of their work careers in order to build workers' capacity and a better workplace overall. An interprofessional team is better to support all aspects of this program. Interprofessional teams provide diverse opinions and best support a workplace environment through teamwork. Our team implementation steps work best with an interprofessional team. The organization should follow the suggestions outlined in the previous slides in order to build the comprehensive environment that is needed to support staff and organization success. The short-term components of this are hiring adequate staff, paying those staff equally, and then creating resources that support employees. The long-term implementation steps is implementing team and individual training over the course of their work careers in order to build workers' capacity and a better workplace overall. An interprofessional team is better to support all aspects of this program. Interprofessional teams provide diverse opinions and best support a workplace environment through teamwork. Our team implementation steps work best with an interprofessional team. The organization should follow the suggestions outlined in the previous The organization should follow the suggestions outlined